Santa Clara, this is from KRON. The Santa Clara County Health Department confirmed a man has tested positive for coronavirus. It's the first case in the county and the first known case in the Bay Area. Oh, Santa Clara Health Department is supposed to be giving a press conference. I don't know if I can show that to you. Let's see. I'm going to see if I can find you a version that I can show to you. If not, we'll just report on it. Hang on a second here. Oh, hang on. I can get the press conference. Let's look at the press conference. Okay, we're about to see the press conference. Here we go. This is the press conference. It's about to happen. All right, so we're going to watch this press conference. This is from Santa Clara County, California. And just to show you where that is, oops. Santa Clara County is in California, not far from San Francisco. That's Santa Clara County. It includes San Jose. There's Santa Clara County. That's what we're talking about, Central California on the coast, south of San Francisco and south of Sacramento. Okay, so that press conference is supposed to start any time now, and we're going to show you that. Give me just 1 second here. Let me just do something real quick, and then we will show you that press conference from Santa Clara County. Well, that worked out okay because it hasn't even started yet. Okay, let's go back to that. So there, again, are they going to start? I think they're going to start.
Good afternoon, and thank you for being here. My name is Mariana Moles. I'm the Public Health Communications Officer for the County of Santa Clara Public Health Department. Today we have an update for you about novel coronavirus in Santa Clara County. First, I'm going to introduce our speaker, and then afterward we will have time for questions. So today, Dr. Sarah Cody, who is our County Health Officer and Director of the County of Santa Clara Public Health Department, will provide a brief introduction. So thank you. Sarah.
Good afternoon, and thank you for coming today. I'm Sarah Cody, the Health Officer for Santa Clara County. Earlier today, the CDC notified us that a resident of our county is confirmed to have the novel coronavirus. As you know, this is the first case in Santa Clara County and in the Bay Area, and many of our residents travel frequently for business and personal reasons. We're not surprised to be announcing the first case in the Bay Area and in Northern California. Actually, we've been preparing for this possibility for weeks, knowing that we were likely to eventually confirm a case. Preventing and controlling the spread of infectious diseases is what local public health departments are built to do. It's one of our core functions, and we are in full swing. Although we are announcing a confirmed case today, please know that we do not have evidence to suggest that the novel coronavirus is circulating in the Bay Area, in Santa Clara County, or really in Northern California. The case is an adult male who lives in our county. He had traveled to Wuhan, China, and became ill upon returning home. Since his return home to the county, he has been self-isolating at home and did not leave home at all, except to seek medical care. He was seen in a local clinic and hospital, but was never sick enough to be hospitalized. We are currently reaching out to anyone he may have come into contact with to assess whether they may have been exposed to the novel coronavirus. Our preliminary investigation indicates that he came into contact with very few individuals after returning home. We are making sure that anyone that he did come into contact with is being monitored for symptoms and staying at home away from others. We are working closely with our healthcare partners, the state and the CDC during this investigation. They are advising us and have offered staff resources. We are also working closely with our colleagues in the county and in the Bay Area. And I have to say that the support from our healthcare and public health colleagues has been tremendous, and we thank them. So what does this mean for the general public? Although we do understand that this confirmed case may raise concern, this one case in fact does not change the risk to the general public. Our assessment is that the public at large is still at low risk because this case was careful to self-isolate at home for the entire time since he returned from China. Thank you.
Before we take questions, I do want to let our Spanish TV stations know that we will have time following the press conference to do one-on-one interviews with Dr. Sarah Cody. So now we will take questions. We have both Dr. George Hahn, our Deputy Health Officer, and Sarah Cody, the County Health Officer, to answer questions. Yes.
How long was he in Wuhan before he started developing symptoms? And he said he hasn't come in contact with many people. Did anyone outside of his family?
What we know is that the case returned on January 24th. Since his return, he has only been at home. Very few contacts in his home, and he has been there the entire time since his return, the only exception being travel to seek care.
He returned from China on January 24th?
He did not return directly from Wuhan.
When did he return?
So I don't have the exact details of where he was when prior to his arrival back here. He did return. He had been in Wuhan, he had been in Shanghai, and then he came back to the county on January 24th.
How about his family members? Are they also on quarantine? Are they still in the hospital?
So as part of our public health practice and our public health investigation, we identify all contacts, all close contacts, and those contacts then isolate at home for 14 days.
Given the human-to-human transmission case that was confirmed in Chicago yesterday, what steps are you taking to launch recruitment?
So the question is about what steps are we taking with regard to human-to-human transmission. So we're doing the following. This is really part of a public health contact investigation. So our team is working diligently right now with help from the state and the CDC to stand up a full contact investigation, very meticulous, understand who his contacts were, and then follow up with each and every one of them. We're actually quite lucky in this case in that I think the contact list is going to be rather short.
Are there household members?
There are household members, few. I'm not going to give details on exactly how many, but what I can say is that, again, we are quite fortunate in this case, and that I think the list of contacts since he's returned here to the county is going to be very short.
When you say short,
Can you handle the question?
Yeah, excuse me. Next.
An adult male.
what's the case here? So he's got the symptoms. He just stayed home. What's going to happen from then on? Will he receive any care?
So since the patient returned back to the county, he has been self-isolating at home for the entire time. He has not gone out except to seek medical care. He has not been very ill, so he's not been ill enough to require hospitalization. He's just been in for outpatient care, so he's currently being isolated at home, and we will be following him closely at home until he's no longer infectious.
Next question.
So what's the sort of evidence would you need to see to make the determination that the virus was indeed circulating in the community?
Right. So one question is, what do I mean by circulating? And that is, I mean that, for example, influenza virus is circulating in the county now. We know that it spreads person to person, and we see cases in outpatient clinics and in hospitals, and we have deaths every year from influenza. That virus is circulating. The novel coronavirus, to date, we've identified in one individual in our county that was confirmed this morning. So that means that if you've not identified it in more than one person, it's not circulating.
Were that to happen, it would follow a similar trajectory as the flu?
Hang on, they might have lost their signal. Waiting to get their signal back. I wonder if they lost their signal. Let's see. Their broadcast seems to have stopped broadcasting. I'm going to hit refresh and see if that helps anything. I don't know that it will.
Focuses on, I understand, is it spreading? How is it spreading? But I want to emphasize, to date, we have one confirmed case. It's the third case in California, despite very active surveillance, looking, and testing.
Next question. Excuse me.
Do you have someone else with a question?
He's had a question.
Did he
Yes.
travel alone, and where in Santa Clara County was returning to?
I don't have any information about his travel companions, and I can't give the city. I can just tell you that he resides in the county.
Do you have a question?
I don't think I can answer. I don't think I can answer that question. We're not going to be giving out information.
Go ahead.
Can you give someone else a chance to answer a question?
They feel like they're doing something to stay protected.
My general message, and what we have been emphasizing, and I want to continue to emphasize, is that right now we're at the peak of the flu season. Flu is circulating widely. Hospitals are seeing a lot of influenza. Far more likely for people to become ill from the flu. So general messages that are really, really, really important. If you're sick, stay home. Stay away from others. Second, if you're sick and you're with somebody else and you cough or sneeze, do it in your sleeve. Use tissues. Wash your hands carefully. If you're not sick and you don't wish to be sick from other people, it's also really important to wash your hands frequently and to avoid touching your eyes, nose, or mouth. And finally, there's still flu circulating, and so if anyone has not had their flu shot, we really encourage that.
Next question.
Doctor, when you said the 24th, was that the day that he landed back here?
Yes, he landed.
All right. They seem to be having some issues. I think I'm going to go away from this because it looks like the press conference is almost over. So, again, that's Santa Clara County, California. They said an adult male in Santa Clara County traveled recently to Wuhan and Shanghai, China. He got back to Santa Clara County on the 24th of January, and it turns out he does have the coronavirus, but he's not that sick. He didn't have to be hospitalized, and he's self-isolating. They said he had very few contacts in Santa Clara when he was back, they think, but he does have several housemates, so I'm sure they're all going to be under observation, the housemates. So that is the seventh new case. Okay, hey, I hear there's a new update. Hold on a second, guys. Hold on a second. That's the seventh new case in the U.S. I think we might have an update from China. Let's see here. Hang on. I think we may have a Hubei province update. Give me a second. I can actually go to the Hubei province site and get that for you. Hang on one sec. Here it is. I think this is the Hubei update. It's got to load, okay? 1,347 new cases in Hubei province and 45 new deaths. This is Hubei province. Hubei province, 1,347 new cases, 1,347 new cases and 45 deaths. And the number has jumped in Wuhan to 576. Again, this is the Hubei province update. 1,347 new cases, 45 new deaths. Okay. So we're now over 11,000 cases. That's a new update from Hubei province. 1,347 new cases and 45 new deaths. 1,347 new cases and 45 new deaths. And then the Wuhan cases has jumped to 578. Hold on a second here. This is yesterday. Yesterday it was 1220, and today it was 1337. And yesterday Wuhan was 378. And then 2 days ago, Wuhan cases was... Oh, that's not 2 days ago. I think that's... sorry. That's yesterday's. Okay. So, give me one more second here. It's 129. Is this it? No. Okay. So, again, this is the new update from Hubei province. 1,347 new cases in Hubei province. Yesterday it was 1220. 45 deaths. 45 deaths in Hubei province. Yesterday it was 42. So the new Wuhan cases is up from 576 to 576 from 378. And this is source government press releases. New cases in Wuhan rose to 576 yesterday from 378 the day before. Wonder if they're testing more. Okay, so again, Hubei province has added 1,347 new cases and 45 deaths. The number of cases in Wuhan is up to 576 from 378 the day before. A government official, the head of the Wuhan Chinese Communist Party, had said in an interview on Tuesday that they had only been able to test about 300 people a day in Wuhan. So I'm wondering if the leap from 378 to 576 in Wuhan is due to increased testing in Wuhan. I don't know. But the number of cases is now over 11,000 cases. Hold on a second. Hey guys, please do not yell in the chat room. Please do not yell in the chat room. You will be timed out. If you yell, you will be timed out. Please do not yell in the chat room. Yeah, the BNO update is just what we were telling you. This update from BNO, I believe, is they just added the Hubei province cases. They just added the Hubei number to this number. That's what I think that is, basically. Now, another thing that someone pointed out is 50 new people were discharged. 1,347 new cases, 45 new deaths, 50 people were discharged from the hospital. 50 discharged in the hospital. 50 discharged in the hospital. 1347 new cases in Hubei, and 45 new deaths. Now, right now there are 338 critical cases. 338 critical cases in Hubei and 956 severe cases. 956 severe, 338 critical. And also, I want you to notice that there's now 726 cases in Huanggang. The city of Huanggang now has 726 cases. Okay, so the city of Huanggang next to Hubei now has 726 cases. All right, so again, and then 6,738 cases are still being treated in the hospital. So in Hubei province, 6,738 cases still being treated. But 726 cases in Huanggang. So Huanggang, you can see it's next to Wuhan. (726 cases now in city of Huanggang. That's a lot. It says 726 in Huanggang and 628 in Zhaogan. And Zhaogan is also next to Wuhan. (726 cases now in city of Huanggang next to Wuhan. 628 cases in Zhaogan. Okay, we have almost there. I'm almost done updating the graphic. Okay, I think I'm done with that. Here's this. Let's go to the graphic. Let's get the graphic updated. And we have that. Okay, that, nope, that's not the, it's right, but it's not right. We have that. There, that's correct. Okay, and then let me just, the other thing I want to do really quick is update the title, because since it's such a different number of cases right now, allow me to just update the title on YouTube. So it's 258 dead. It's 11,301 cases. Okay. And then the number of international cases is 10 plus, it's 136 is the international cases. So 11,301. 136 will be 11,165. Okay. All right, 11,301 is the total. 258 dead. And the number of cases in China is 11,165. Okay, I think I have fixed the title of the broadcast. Let me just save that and we'll be good to go. Okay, so again, we just got this new update in from Hubei province. This is the province where Wuhan is. And they report 1,347 new cases, 576 of those in Wuhan. And 45 new deaths. And this is just Hubei province. And it's interesting, the last couple days, the numbers from Wuhan have been in the 300s. Now, there are a number of scientists out there from different countries who think the number of cases in Wuhan is in the tens of thousands. So, again, there's a lot of people, there's been several groups of researchers who did analyses, and they believe that the number of cases in Wuhan and in Hubei is tens of thousands of cases. So, you know, we were discussing yesterday the possibility that the numbers from Wuhan in the last couple of days have been like, you know, in the high 300s of new cases. But we're also hearing lots of reporting about testing kit shortages in China, specifically in Hubei province and Wuhan. So since that number from Wuhan jumped from 378 to 576, I'm wondering if they're just testing more people in Wuhan now. And I don't know to what extent, you know, when the national government comes out with their statistics, they will release the number of suspected cases. Those are going to be people with symptoms, I believe, but who have not been tested yet. And that number has really taken off in China over the last few days, suspected cases, which makes me think maybe there's like a testing backlog and they have a lot of people to test now and they just don't have enough test kits. So, you know, these are just, first of all, these are just the official statistics. Who knows how many other people have it? Who knows how many people had it the last month and a half and died from it and was never reported? Or it was intentionally not reported. So we don't know that. But even among the official statistics, you know, these might be understated just because there's a testing shortage, a testing kit shortage. But these are certainly concerning numbers here. Over 11,000 cases in China now, and we're going to hear about several hundred more shortly because the rest of China will report their numbers in addition to Hubei province. So, quite worrying to see these numbers keep going up like this. And it certainly will keep straining the resources. Every day, more and more cases, more and more close contacts, more and more confirmed cases, more and more suspected cases, more and more close contacts to track down and keep an eye on. It's just going to put more and more strain on a healthcare system, which is under a lot of strain. Reportedly, there are lots of healthcare equipment shortages like masks and protective gear in China. It's not going to help with the shortages when you have these kind of numbers of new cases every day. So we're going to keep bringing you updates here, but a lot going on with this. And new cases around the world. A 7th case in the U.S. we just heard about in Santa Clara County. There's a 7th case now in Germany. The first case in Sweden. Overnight there was the first 2 cases in the U.K. So it really is, we're hearing about new cases around the world, not just in China. But the numbers in China are just getting really, really big. Thanks for your support. Kevin Simpson. Thanks, Kevin Simpson. Thank you, Dee, for your support. Thank you, The Watchmaker. Thank you, Dominic Harris. Thank you, Max. Thank you, Tanya Brown. Thank you, Kyle. Thank you, Rupert and C. Johnston, and Linda Fay, and Bob Blitheract, and R. Ross, and D. So thank you for all of your support, and thank you to our moderators as well. We have right now, Becky Scarlett is moderating our YouTube chat room, Mark Helton, and they are there moderating. Rurbin is there moderating. So thank you to all of our moderators there. Thank you to our Periscope moderators. Texas Legends Brian is moderating. Sharon Craig is moderating. Katsy I think I can't remember all the time all the moderators in Periscope. I can't remember if Catsy is. Catsy, if you are, thank you. If you're not, please ignore what I said. So thank you to all of our Periscope moderators. Thank you to our Facebook moderators as well, and our Twitch moderators. Our Twitch moderators include people like Daily Disclosure, Matthew Johnson, Umarath Smoke, Idaho Star, Keisha Callie, and others. So thank you. And thank you to our Facebook moderators as well. Courtney Lane is there moderating. And thank you, Courtney. And thank you to, for this Facebook stars, thank you to Ashley Victoria Johnson and Lena Temnikova. Thank you, Ashley and Lena, for the Facebook stars. And also Kathleen Cosby, Courtney Lane, Jason Belanti, and Chime Maga for the Facebook stars. And thank you for the Super Hearts. Sorry, hang on one second here. One more thing to mention. Chris and Texas Legends fan Brian. Okay, let's get the latest updates here. So much to talk about right now. So, the latest Hubei province update, again, was, you can see it down here, 1,347 new cases. Oh, first case in Spain. First case in Spain is being reported too. First case in Spain. So let me just show you that. First case in Spain. Here it is right here. Here it is right here. One of the samples is tested positive for coronavirus. Ministry of Health. In Spain. What was the source they gave on here? Hang on. There it is right there. Hang on, we'll get some details about this. Spain reports first case of coronavirus. Oh, hold on a second. Spain's first case of coronavirus is someone who had contact with one of the cases in Germany. This is pretty crazy. This is pretty crazy. So, coronavirus arrives in Spain. First case confirmed in a German tourist. The patient is isolated in a hospital of the Canary Islands. It is part of the group of 5 tourists who were already under observation. They had been in contact with Germany with a patient diagnosed with coronavirus infection. Wow. Okay, so what this means is a person. An employee of a German company visited the company in Germany, right? And then this says had been in contact. And 6 employees and 6 German employees of the company didn't show symptoms in Germany, but now 6 employees of the company who had contact with her have the virus. One of their kids have the virus, and someone in Spain who had contact with them has the virus. So a Chinese employee of a German company visited the company in Germany, didn't show symptoms in Germany, but now So a Chinese employee of a German company visited the company in Germany and didn't show symptoms in Germany. But now 6 employees of the company who had contact with her have the virus. One of their kids has the virus, and someone in Spain who had contact with them has the virus. That's true. That's all true. It's amazing. That whole Germany case is crazy. Again, an employee of a German company visited the company in Germany. She was not symptomatic while in Germany. She actually started showing symptoms when she went back to China. But 6 employees from that company now have the virus. One of their children has the virus, and a person in Spain who had contact with people from that company now from that company now has the virus. I believe the employees who were sick. You can see it says right here, noticias. They had been in contact in Germany with a patient diagnosed with coronavirus infection. So, in theory, they could have been in contact with the woman too. Let me just do this. Source for info on new Spanish case below. It says the person was in contact with someone in Germany diagnosed with the virus, which I assume means one of the German employees, but could mean the child of the employee or the Chinese worker when she visited Germany. Oops. Just making that clear. With a patient diagnosed with the virus. So. All right. Source for info on new Spanish case below. It says the person. It says the person was in contact with someone in Germany diagnosed with the virus, which I assume means one of the German employees, but could mean the Chinese worker when she visited Germany. Okay, if I'm getting that all right. All right, so that case in Germany is kind of crazy. It's kind of crazy. Again, a Chinese employee of a company in Germany visits the company. She doesn't have symptoms in Germany. Now, 6 people in Germany for that company have gotten the virus. One of their children has gotten the virus. And somebody in Spain who was in contact with one of the people in Germany also has the virus. Okay, so let's just update you here. A lot to cover. Oh, the number of cases went up by 1, so I need to actually adjust that. Hang on 1 second here. You can see first case in Spain. Thanks, by the way, to D. Thank you, D. And thank you, Rachel Rizal. And thank you, Heather Cliff. And thank you, Casual Johnable. Thank you all for your support. And our viewer, Casual Johnable, says something like 11% of countries have the virus to some degree now. I haven't done the math, but there are a bunch of countries that have it, that have somebody with it. Let's see here. We're waiting for the big China update. So we've gotten the big morning update from Hubei province. That's why the numbers have jumped. But we have not gotten the update from the rest of China yet, which in past days has been around like 500 people. So we'll see what it is today. But that number is going to go up more. 11,302 worldwide now, 11,302. Let me also do something real quick. Allow me to do something. This will take 2 seconds here, if I can. I think this is going to work. Yeah, I was just going to update the title on the Facebook broadcast too. I think that should work, if it lets me. Yes, that did work. And I don't know if I can update it for Twitch. I will try to if it lets me do that. No, it's not going to let me, I don't think. All right. Okay, so we're waiting for the big rest of China update, but wow, over 11,300 cases worldwide and over 11,100 in China itself. Flint Fireforge says, sadly, the serious and critical numbers keep getting worse. That will increase the number of dead every day. Thank you for keeping us well informed, and thank you much. Thank you, Flint Fireforge. Yeah, so if just in Hubei province alone, a couple things to keep an eye on. Let's go back to this Hubei province announcement. So Hubei province announced, this is the most ever official numbers in a day from Hubei province, 1347. Now, one thing that is happening is the last few days, the absolute number of new cases has gone up every day, but the percent by which overall cases grow has not gone up. That's actually gone down. So the last few days, every day it grows by a lesser percentage. So you might think, oh, well, that's good. That means the outbreak is getting under control. The problem is, what we don't know is how much is the widely reported shortage in testing kits holding down these numbers. We have seen a huge increase in the number of suspected cases the last couple days. So it's possible that there's a widely reported shortage of testing kits. It's possible that if they had been able to test more people the last few days, the number of cases would be a lot higher. So it's hard to really get a sense of, what the actual growth rate of the actual number of cases is, because we don't know, because there's a shortage of test kits. But this is the highest absolute number of increase in Hubei province for a single day, 1347. And 45 deaths is the highest number of deaths in a single day, I believe, from Hubei province. Now, also, if you look down here, it says, in Hubei province, over 6,700 people are being treated in the hospital in Hubei. That's just confirmed cases. That's not like suspected cases. And then also 956 in the Hubei province who are severe cases, and 338 critical. 338 critical. And then look at this number, 36,800 people are close contacts. These are all close contacts of people who are confirmed cases who might get it, and they're under observation. And in the whole country, there's over 100,000 people who are close contacts who could get it, who are under observation. But this is it's a big jump, and I expect to see 500 or something like that cases from the rest of China when they announce it. That announcement should come at any time. But it's quite worrying to see this keep going up and to see more and more cases around the world. We got to talk about some of the international cases as well. Thank you very much to Rising Gamers, Cheesy Libs, R. Ross, D. Thank you, D. Thank you, Upstate Zach. Upstate Zach mentioned the CDC report. Yeah, I'll try to get to that. Thank you, Zach. And but there's now 7 cases in the U.S., the first case in Spain, we just talked about that, the first case in Spain, a 7th case in the U.S. in Santa Clara County, and then 1 new case in Taiwan, 1 new case in Hong Kong. I haven't even talked about these yet. One new case in Canada, a 4th case in Canada was reported. This is the 3rd case in Ontario, the 4th case in Canada. So Ontario. This is linked from, if you want to see this timeline, it's a very good timeline, go to bnonews.com, bnonews.com. They're posting updates and updating the totals and have links to sources down here. So they're doing a great job. So Ontario confirms its 3rd case. This is Canada's 4th case. Let's see here. The newly confirmed case is a female in her 20s who arrived in Toronto without symptoms on January 23rd. On January 24th, she started to exhibit symptoms. She's been in isolation since January 24th. I read a report that this person had traveled to Wuhan. Let me show you that. I read that a little earlier. That was not confirmed, however. So here is that report from the Globe and Mail. 4th case of novel coronavirus confirmed in Canada from the Globe and Mail. And what it says is, the woman had so little of the virus in her system that Public Health Ontario's laboratory initially failed to detect the infection. She's a university student who recently traveled to Wuhan. So I wonder, did she maybe go to Wuhan for winter break or something? She landed in Toronto on January 23rd and was transported in a private vehicle to London, where she attends the University of Western Toronto. In Canada, Canadian officials said there was no need to track down passengers who sat near her on the flight. See, I'm so confused. This is another pronunciation from Ontario's chief medical officer. Ontario's chief medical officer says there's no need to track down the passengers who sat near her on the flight because she was asymptomatic and wearing a mask. I mean, why is he making these pronouncements? First of all, being asymptomatic does not... China has said you can give this to other people without symptoms. There's a paper in New England Journal of Medicine that says the Germany cases show you can give this to somebody without symptoms. So why is he saying there's no risk? What if she wasn't wearing her mask correctly? What if she shook hands with somebody on the flight? Couldn't that, in theory? What if she was eating and put her hands to her mouth and then, touched somebody next to her? There's literally no risk at all. No risk. No risk. It's Ontario's chief medical officer. It's the same person. Last week, Ontario's... he said it last week. Ontario's chief medical officer is claiming there's no need to track down passengers who flew with the new Canada patient case because she was asymptomatic and was wearing a mask. So the passengers were at no risk, he says. Look, it says, where is it? Dr. Williams, Canadian officials said there's no need to track down the passengers and there's no risk. Where are they getting this info about no risk? Canadian officials are claiming there's no need to track down passengers who flew with the new Canada virus patient because she was asymptomatic on the flight and was wearing a mask, so the passengers were at no risk. Where are they getting this info about no risk? I don't know where they're getting this information. Last week, one of the head medical officers in Ontario, it might have been the David Williams guy, but one of them said in a press conference, well, you can't spread it if you don't have symptoms, which was just wrong. It was just wrong. He said it and it was wrong in a press conference. Now, why are they saying there's no risk? Asymptomatic doesn't matter because you can give it to somebody without symptoms. So just because she's wearing a mask, she can't give it to anyone? There's no need to track down passengers who sat near her. There's no risk to other passengers on the flight? None? It just seems kind of ridiculous. That's the second time in a week Canadian officials have made a pronunciation which is not backed up by what I've heard scientists say. The thing they said last week was just wrong. It was just wrong when they said in a press conference, you can't get it from people without symptoms. That's just wrong. And then to say there's no risk because somebody was asymptomatic and wearing a mask. Well, again, there's a paper in the New England Journal of Medicine that just came out that says the Germany cases are a case where somebody didn't have symptoms and gave it to a bunch of people. So forget the asymptomatic. So it seems like their argument is if you have a mask on, you can't give it to anyone else. Really? If you have a mask on, there's no chance you give it to anyone else? None? And that's just stupid. I don't know why they keep doing this. It's Ontario. They keep doing it. If you want to say you think there's low risk, well, that's different. But to say there's no risk, we don't have to track anyone down, I don't know. Seems ridiculous. Just, if you don't know, don't say it. That's all I ask. Canadian officials saying there's no risk of transmission from airplane passenger who's asymptomatic and wearing a mask. Remember that according to a paper in the New England Journal of Medicine, the Germany cases are apparent cases of asymptomatic persons spreading virus. Canadian officials saying there's no risk of transmission from an airplane passenger who's asymptomatic and wearing a mask. Remember that, according to a paper in a New England Journal of Medicine, the Germany cases are apparent cases of asymptomatic. The Germany cases are apparent cases of an asymptomatic person spreading virus. Anyways, it's ridiculous. It drives me crazy when public health officials just make these pronunciations, and I don't know which have not been backed up by science. Sorry, it really drives me nuts. It's the same people who said last week, you can't get it from somebody. The Ontario chief medical officer last week said, you can't get it from somebody if they don't have symptoms, which was just wrong. So they're not going to track down anyone on that flight with the new Canadian patient because she was wearing a mask. That's what they said, basically. All right, let's get back to the updates here. Oops, I should say this. Well, hold on a second. Let me real quick. I just got to post the source for that. Give me one more second. One more second. Hang on. Sorry. I just need to do proper sourcing on my tweets. Source for quote, an original tweet from Canadian officials. All right, we are back. Hey, thanks for your support. True Progress. Thank you, True Progress. Unite for Peace. D. Thank you, D. Thank you, Paul Phillip. Thank you, Penguin Overlord. Thank you to Isita, Stefio. Thank you, Gina Mancini. Thank you, Miss T. Thank you, Miss T, Gina Mancini, Scarlett Wintour, and We Are Awake News. Thank you. And Gina Mancini again. Thank you. And a couple things. First of all, Gina Mancini asked about, she said she got a package from China. I get this question a lot. Can I get it from a package from China? Every expert I've seen quoted about this says it's highly unlikely to get the virus from a package from China because viruses don't survive that long outside the body. But I don't know for sure. So don't trust me on this, but I can say that when I've read articles on this, experts seem to think it's unlikely that the virus would be spread by a package because it wouldn't last that long outside of the body. And then True Progress thinks the current Canadian government is being politically correct. Well, I don't know what's politically correct even. Why is it politically correct to say we don't need to track down anyone who flew with this new victim because she was wearing a mask and asymptomatic? I mean, why? I don't know why it's more politically correct to say you don't need to track down anyone than you do need to track down someone. That's just a statement about public health. I don't. It's not. You're not even talking about the original person, really. Again, Canadian officials said they're not going. There's no need to track down any of the people who flew with the new person from Canada who has it because she was asymptomatic on the plane and wearing a mask. Well, asymptomatic shouldn't matter because there's apparently a case in Germany where a person gave it to a bunch of people without having symptoms. So then you're really saying, well, I don't even know why they're mentioning asymptomatic. And then, so basically what they're saying is, no one's at risk because she was wearing a mask. And first of all, that just seems like totally unproven. And it would seem like there's certainly, some coronaviruses you can get from shaking hands with someone. And couldn't she have touched her hand with her mouth or something, or mouth with her hand? And then also, who's to say she was wearing her mask properly the whole flight? It just drives me crazy. So, Robin Hogg says, has China stopped flying around the world? No, China has not stopped flying around the world. A bunch of airlines are no longer flying to China. Now, the U.S. made an announcement today. Several U.S. airlines said that they're not going to fly to China. I think it was American, United, and Delta. But there are airlines still flying between the U.S. and China. The U.S. announced that they announced a couple things. I think they said that all of the airlines flying from China to the U.S., I think they're going to be shunted towards 7 airports. There's only a limited number of airports now where planes flying from China will be able to land in the U.S. Also, I think it's anyone who's been in Hubei province recently has to have 14-day quarantine in the U.S. I think that's what they said. Let's see. Yeah, look. U.S. temporarily bans foreigners who visited China. Let me read this. President Trump has temporarily suspended entry into the U.S. for any foreign nationals who've traveled to China. Oh, I didn't even read about this. The action will restrict all foreign nationals who've been to China, other than immediate family of American citizens and permanent residents, from entering the U.S. But immediate family of American citizens can still come in. Oh yeah, it's not a ban. It's not a ban. It's, look, beginning on February 2nd, any U.S. citizen, oh no, this is U.S. citizen. Oh, Any U.S. citizen returning home who's been in Hubei province within the last 14 days will be quarantined for up to 14 days. Those who've been in other parts of China the last 14 days will be subject to proactive entry screening and up to 14 days of monitoring and self-quarantine. Also, all flights from China will be funneled to just a few airports, including Kennedy Airport, Chicago's O'Hare, and San Francisco International Airport. I didn't hear about this, though, the ban on people visiting China. So if you're not a citizen and you visited China recently, you can't come in? Is that what it is? Yeah. U.S. will ban foreigners who visited China in the last 14 days from entering the country. Let's see if I can find a better, another update. That's from BNO News. I want to see if I can find an article about that. Now, Tom Cotton says, now that all the U.S. carriers have done the right thing, time to ban all Chinese airlines from flying to the U.S. There are still Chinese airlines flying to the U.S. Delta, American, and United have suspended all mainland China flights. But there are still Chinese airlines flying to the U.S. Let me see. If I can find something. U.S. temporarily bars foreigners who have recently visited China from entering U.S. I gotta tweet that out. U.S. temporarily bars foreigners. Okay, so that happened. All right, so we're waiting. Let's just get caught up here. Let's just get caught up. Hold on. There's a lot going on. There's a lot going on, and I want to get caught up. Thank you to General Sorrow and D. Thank you, D and General Sorrow. I appreciate it. And Holly Napier. Thank you. Thank you, Holly Napier. Okay, let's get caught up here. And D, thank you, D. I appreciate that, D. Thank you. Okay, so we already got the big update from Hubei province. In case more cases, 1329, 11329. So this is probably from a province. 27 new cases and 1 new death in Chongqing, China. So we're waiting for the major update for the rest of the country. We've already gotten Hubei province for today. There were 1,347 new cases and 45 new deaths in Hubei province. That's where Wuhan is, yesterday. We're waiting for the update from the rest of the country, which I expect to be around 500-600 cases. But some other provinces and municipalities are already reporting. The municipality of Chongqing is saying 27 new cases and 1 new death. Now, what I like to do is I like to see what they've reported in past days. So today they said they report twice a day in Chongqing. So previously it was 24, 17, 18, 15. Their last 4 updates have been 22, 15, 18, 17, 24, and this is, oh, then there was 5 last night, and this is 27. 27 now in Chongqing. In Chongqing, just to show you where this is, so that's going to add to the total. Just to show you, I have a province map here. I wonder if it'll show up here. I think it will. China Discovery. Chongqing. Should be here. Beijing, Shenzhen, Shanghai. Oh, maybe that's it right there. Is that it? I spelled that wrong. Yeah, there it is. It's right there. Chongqing. It's a large city, and also it's a municipal area. The protein chief, we got the Hubei morning update. We have not gotten the whole country morning update. So we got the Hubei province morning update there, but we don't have the whole country's morning update yet. So 27 new cases and 1 new death in Chongqing, China, and that's going to raise the total. And let me just look at this. This is from the link that BNO News posted. In Chongqing, 27 new cases. I don't know if that's right. That says 2 hours. I think it's probably more than that. Hey guys, and real quick, hey, thank you, Crew Cut. I just want to say this. I once in a while somebody will say, "Read my message, please," or and they might even make a donation and say, "Read my message." I can't promise people. I'm sorry, I can't promise to read your message because unfortunately there's way too many more messages than I can read on the air. So I want to be clear here. I don't want people, I don't want people to feel misled. I'll do my best to get as many messages as possible, but I can't promise to read them. And honestly, even if you donate, I can't promise to read your message just because there's so much going on. So I just want you to know that, and I apologize if I don't get to it, and I'll do my best to get to it. But I don't want people to get the wrong idea, and I don't want people to feel misled. I don't want people to think I'm ignoring them. So I'll do the best I can. But there are so many messages I get, I just can't promise to read individual messages. I'll do my best to get as many of them as I can. So I really appreciate you writing in and sharing your updates. It really helps me cover everything when you guys share the news. So thank you. But I apologize if I don't get to all the messages. Okay, so 27 new cases in Chongqing, 2 severe cases. I think it's 2 severe and 2, it might be 2 severe and 2 critical. When it says severe and severe, I think it's severe and critical. And 1 new death. There's a bunch in different parts of Chongqing. 238 total cases in Chongqing. 20 severe, I think it's 20 severe, 6 critical, 1 death. I think that's the first death in Chongqing, and only 1 person discharged from the hospital. Okay. Experts believe imported cases are still the main cases, and local cases account for about 20%. We'll see if that stays or changes. By imported cases, they're talking about, for example, there might have been people from Wuhan or Hubei who left there and went to Chongqing for the holidays. So that's new. So we now need to update our total here to 11,329, 11,329, and 2,259 dead. Hey, thanks, by the way, so much to, thank you to, Tanya Brown, Volcanic. Thank you, Tanya Brown. Volcanic. D. Crew Cut. Jari S993. Jari S993 asks about people possibly getting both the flu and coronavirus at the same time. I have no idea if that can happen. I just don't know. And Tanya brings up the R0 number. That's the number of people on average who a new person infected gives it to. I've seen different scientists giving thoughts about that. I don't know what it is. Thank you so much, David DeLuna. I really appreciate it. David DeLuna. Also, remember, scientists are working with very imperfect information on this. We don't know, for example, how many people might have this and have not gone to the hospital. There might have been people who had it the last 6 weeks who never got care, or maybe there were people who died and the government didn't want to report it as a virus, so they didn't actually, officially call it that. So the information might be very imperfect here. There are a number of scientists who believe there are tens of thousands of cases. In addition, more than this. So it's hard, because if you're just operating with the official data, it's limiting because there might be a lot of other cases you don't know about. Hey, thank you, Dee, for your support. Thank you so much, Dee. Really appreciate it, Dee. Thank you. Also, thank you to Michael Hohaj. Thank you, Hohaj. And Jake's... Oh, Bellator. Thank you, Bellator. I really appreciate it, Bellator. Thank you. All right, let's keep updating you here. Sorry, there's just so much going on, and we're still waiting for the big update from the rest of the country. But there is a lot happening with this right now. Hang on one sec, guys. All right. All right, so 11,329 cases worldwide, including 259 dead, and we're waiting for the China update, which should be like around 500 more cases if past days are a guide. Thank you, Gary Powell, by the way. Okay, I want to check some of your comments, and also I want to just check for updates because there's so much news going on. So let me real quick check for some new updates. But there's just a lot going on. Let's check this. And as we mentioned this before already, in Santa Clara County, California, they announced the 7th U.S. patient who had it. The 4th Canadian patient has been announced. We have new cases. There was a new case in Hong Kong and a new case in Taiwan. Look at these international numbers. They're starting to get up there in different countries. 19 in Thailand, 17 in Japan, 16 Singapore, 11 South Korea, 7 US, 7 Germany, 6 France, 9 Australia, 4 Canada, 4 UAE, 5 Vietnam. The first 2 in England last night. Thank you to D. Thank you, D. Appreciate it, D. Thank you. India is evacuating citizens from Wuhan. Ronan Kelly says, emerging disease tracking with emphasis on India. He says there are 366 Indian citizens evacuated from Wuhan. Let's see if I can get any updates on this. Do they have a link there? Yeah, it's a government announcement that says 366 people evacuated from Wuhan, from India. All right, let me take some comments too. Sorry, it's been so busy. Oh, new cases. We have new cases. First of all, new cases. 11,337. I'm guessing another province reported, or city. 8 new cases in Shanxi province. 8 new cases in Shanxi province. So it's up to 11,337. Let's look at that report. That's from bnonews.com. Pass this along. So 8 new cases in Shanxi province. Now, how many cases does Shanxi province have now? Shanxi province has, they're up to 47 cases. 47 cases. Hey, thank you very much, Becky Scarlett. I appreciate it, Becky Scarlett. Thank you. Also, thank you so much from Sweden to Robsta01. Yeah, Robsta says, what are your thoughts on the reports that the virus is patented and released on purpose? So look, there's a lot of misinformation going around about this virus. Now Robsta says we have 1 confirmed case in Sweden, a 20-year-old woman who arrived from Wuhan. Should we be concerned in Sweden? Well, look, I would just, wherever you are, I would certainly pay attention to what your authorities say. That's what I would say. Listen to your local authorities, hear what they have to say. I don't know how much this is going to spread, but I would certainly, keep your heads up and pay attention to local authorities. But there's been a lot of misinformation out there, a lot of claims that aren't backed up. So for a while, this rumor was going around that this thing was patented, and that was supposed to be some kind of huge deal that was connected to the virus. And it turns out, I read an article that said, well, the company being mentioned in these rumors had patented a virus that didn't affect humans, that only affected animals. So, to the best of my knowledge, that's just a completely unsubstantiated rumor. There's also a post going around that's making its way around the internet today where one person said that there's some connection between the virus and HIV, and I've seen lots of scientists say, no, this has not been shown, this has not even been peer-reviewed. So I'm just going to say it again. Just because someone says it on Twitter does not make it true. Let me repeat this. Just because someone says it on Twitter or elsewhere on the internet does not make it true. So please be careful about just seeing a tweet or a post on Instagram or whatever and just saying, oh, I guess it's true. And just because someone calls themselves a scientist in their description or says they're a PhD or says they're whatever, doesn't mean they are. So if there's some huge, important, new thing about this virus, it's not going to be something where you only hear one person saying it. You're going to hear it from a lot of outlets. You're going to have it be confirmed by a lot of scientists. So if it's one person who you've never heard of saying it on the internet, that doesn't make it true. So really be careful with a lot of the misinformation going on there. There's a lot of claims flying around. I see these claims and I get people sending them to me, and then I do some research and I see a lot of scientists saying, whoa, like this has not been shown at all. It's an unreasonable claim to just be spreading around. So just be careful with what you're believing out there. Don't just believe it because one person said it and a bunch of people gave it a like or a retweet. We got to update our total. 11337. cases. Hey, thanks for your support. By the way, Bill Go Mets. Thank you, Bill Go Mets. Thank you also, Kevin McLean. Thank you, Kevin McLean. Yeah, I haven't had a chance to watch the White House press conference. Maybe we'll get a chance a little later. Thank you, Kevin, for that. Thank you, Kevin. Thank you, Becky Scarlett. And again, thank you, Robsta01. Thank you. We're still waiting for the big update, the big morning update from the rest of China, which should add hundreds more cases to this. Again, you can write to me at Lookner on Twitter. EG sent me this. Yeah, and look, the Germany case is seen as a case of this. This is a CNN article. There's no doubt top U.S. infectious disease doctor says Wuhan coronavirus can spread even when people have no symptoms. So I don't know why Canadian officials today are saying, oh, well, the person on the plane couldn't have spread it because they have no symptoms and they were wearing a mask. I don't know what having no symptoms has to do with it. The U.S. top infectious disease doctor says a new study published Thursday night it's the German case, shows people can spread the Wuhan coronavirus before symptoms set in. There was a paper published in the New England Journal of Medicine. I don't know if this is the one they're referring to, but there was a paper published in the New England Journal of Medicine. Yeah, this is it, the New England Journal of Medicine paper. It's about the Germany case. And it says, it appears what happened in Germany is a Chinese person went to Germany and was not showing symptoms in Germany, and now a bunch of people got it from that person. One of the most prestigious medical journals there is. Thanks, Bat Soup, but I don't know about what comments you wrote, Bat Soup. So, anyways. But thank you for your support. But if you break the rules, you break the rules. Thank you, Bat Soup. Thank you also, Fatal from Australia. Thank you, Fatal. Okay, let's see here. Kevin McLean says this is scary. The doctor says some days the virus is present in patient testing and some days it is not. Makes you wonder if suspected cases should be tested multiple times before being ruled negative. Thoughts? I haven't actually heard this yet. Hold on a second. I haven't even heard it. That's interesting. So what was said, this person said in the press conference that a patient with this virus, that's a very interesting point, that some days they can show it and some days they cannot show it. That's interesting. I don't know if they take that into account with the testing. I don't know if they do. I don't know in terms of ruling negative, Do they just give one test, or do they give a couple different tests? I don't know, Kevin, but that's a good point. I'd be interested in knowing more about that. Thank you, Kevin. I just don't know enough about it. I haven't heard more about that. I'd be interested in seeing some articles about that. So I'm just checking some things here. Again, you can write to me at Lookner on Twitter. Tig Cell Network sent me this. Israel bars. A bunch of countries are taking different measures. I believe Singapore is not allowing people from China to enter Singapore now. Israel bars land, sea entry to foreigners recently in China. This is similar to what the U.S. did. They said if you're recently in China and you're not from the U.S., you can't come in. In Israel, according to Times of Israel, anyone who's visited China over the past 2 weeks who's not an Israeli citizen or a permanent resident will now be banned from entering the country through a land or sea crossing until further notice. So a bunch of countries are putting restrictions on people coming into the country who have recently been in China, whether or not you're Chinese or not. Oh, Persica says there's a new case in the UK. Let me see. I haven't seen that yet. There was a couple of new cases last night in the UK. I have not heard a report about the new UK cases aside from the two that came out last night. I'll show you something about that. Two cases confirmed in UK. Two people from the same family have tested positive in the UK. They are Chinese nationals. They were guests at the Stay City Apartment Hotel in New York. The hotel remains open for business, but their apartment will be thoroughly disinfected. Would the virus survive on a tissue? Probably. Public Health England says a virus would survive probably for 15 minutes on a tissue, but it is unlikely to survive on surfaces like door handles for more than 24 hours. So Public Health England says the virus was unlikely to survive on surfaces like door handles for more than 24 hours. Who qualifies as a close contact? Anyone who's within 2 meters of the infected person for 15 minutes. Okay, so we are waiting just to update you in case you're just joining us. So this number keeps going up. It just is growing every day. And today, in the latest update from Hubei province, they announced a new high total for them for a given day. 1,347 new cases in Hubei province alone. 45 new deaths in Hubei province. That includes Wuhan. and the number of cases in Wuhan was up from 378 to 576. I'm wondering if that's because they're able to test more people. There's been a shortage of test kits in China to test people. So we're waiting for the update from all of China, from the rest of China, and that update yesterday, in addition to Hubei, there were 622 other new cases. And then there were 536. Actually, I don't know. The 622 and 536, roughly speaking, the last couple days, in addition to Hubei province, there's been like 600 new cases reported from the rest of China. So we should be getting that update soon from the rest of China, which is going to add to the number of cases. Hey, thanks to our moderators very much. We have Mark Helton is moderating. Thank you, Mark Helton. Lamar Watkins. Hang on. Mishi Melody, Trish Lancher, Becky Scarlett, Michael B. They're all moderating. Thank you to the moderators. Also, our Periscope moderators. Sharon Craig is there. Thank you, Sharon Craig, for moderating. I know Texas Legends fan Brian was there moderating. Thank you. And speaking of Periscope, thank you to SQ Tweets, William Bowser, Gunter Doze, Maria Urero, Timothy Cornegay, Maddie, and Deb H., and Texas Legends fan Brian, Chris, and the Mystic Autistic for the Super Hearts. Thank you. Oops. Hold on a second. I need to actually plug my iPad in. All right, hang on a second here. And thank you, Catsy is also moderating in our Periscope chat. Thank you, Catsy. Thank you also to our Facebook moderators. Really appreciate it, moderators. Thank you, moderators. I know Courtney Lane has been in there moderating. Thank you, Courtney, for moderating. Much appreciated. And thank you for the Facebook stars, Jenna M. Kennedy, Corby Kessler, Vicky Morgan, Lisa Grialis, and also Lena Temnikova, Ashley Victoria Johnson, Kathleen Cosby, Courtney Lane, Jason Valenti, and Chime Maga. And our Twitch moderators, including people like Daily Disclosure, Matthew Johnson, Idaho Star, Smoke, Umarath, Keisha, and I'm forgetting some, Callie, and others. Thank you. So we're waiting for the new update from the rest of China, which should come any time now. Sorry, I'm just checking for a couple updates here. And you can give me a shout with your comments, questions, updates at Lookner on Twitter, where you can reach me at Lookner on Twitter. This is I wonder which one this is. V2019N says some rumors and disinfo on coronavirus had been coming from one particular Twitter account. It has been suspended. I have a thought as to one account it might be. I'm not going to mention on the air, but I wonder which one was suspended. You also check here. This is actually a new an article here. I haven't mentioned this yet. This is from the Reddit. One of the Reddit threads on this. One of the Reddit subreddits is r/China_flu, and they're posting a bunch of articles about in comments about the virus. And they posted this one. I actually hadn't mentioned this from Ars Technica. Coronavirus outbreak sparks first federal quarantine in over 50 years. So the Americans who evacuated from Wuhan were voluntarily staying under quarantine. They were self-quarantining, and one of them tried to leave, and then they were ordered to stay. But that was a local order. But I guess today the federal government gave an official order that they are now under official 14-day quarantine. The U.S. CDC has issued the first federal quarantine order in more than 50 years for 195 Americans who were evacuated out of Wuhan. They will be held under quarantine at the March Air Reserve Base in California, and they'll definitely be there for 14 days now. The quarantine will last 14 days from the time of their flight. 14 days is considered the likely maximum time of a coronavirus infection incubation period. So basically, if you're quarantined for 14 days, they'll be able to tell if you have the virus or not. You'll either show symptoms or you won't. Still waiting for the major update from China, their morning update. Oh, I should update my graphic too. I'll do that in a second. Oh, Zero Hedge was suspended. Wow. Zero Hedge was suspended. It seems like it's coming back. Zero Hedge, I can see it now. I can see Zero Hedge. That's the normal picture for it. It's not been hacked, by the way. That's the normal picture. But I'm not seeing any tweets. There's no tweets. So you can see the account now, but there's no tweets. So the account, I can see the account with no tweets. So you can try to go there. Again, I can see the account right now. It's very weird. It's doing this. This is what it's doing when I try to load it. Account suspended, and then it comes up, but then you can't see the tweets. So I don't know. I don't know what's going on with that account. Maybe it's going to get restored. So, and I see some different people are posting different things about what they might have done, Zero Hedge, but I'm not going to speculate on that because I just don't know. Thanks for your support, by the way. Thank you to Malta McMurchie. Thank you very much, Malta McMurchie. Thank you also to AC. AC says, are travel to Hong Kong and Taiwan included in the new USA-China ban on foreigners? Well, the new ban on people who are... There's a new ban on people who are not U.S. citizens coming into the U.S. if they've recently visited China. So I think what you're asking is Hong Kong count as part of that? I don't know. I don't know if Hong Kong counts as part of the group. If you visited Hong Kong recently, are you not allowed to come to the United States if you're not a U.S. citizen, or is it just that you visited mainland China? Where is that? I'd like to actually see the site where it's posted. I don't know which government agency posted it. U.S. bans foreigners coming from China for now over virus fear. But President Trump signed an order that will temporarily bar entry into the U.S. of foreign nationals other than immediate family of U.S. citizens and permanent residents who have traveled to China within the last 14 days. I don't know if China includes Hong Kong. Hong Kong is part of China, but I don't know if Hong Kong is part of this. I just don't know. I'm not seeing it posted yet on the White House site. So I just don't know. It's a good question. And again, we're talking about this. The account Zero Hedge has been suspended from Twitter. And I'm not sure if that has to do with them posting stuff about the virus. I just don't know. But Zero Hedge has been suspended from Twitter, possibly for posts related to the virus. And you can see it says it's suspended. Oh, and then somebody mentioned, I'm sorry, there is the Zero Hedge website, which is still up. So, yeah, now just to be clear, guys, there is a tweet about this. This is the tweet I was talking about. There's a tweet by someone that claims there's some connection between HIV and coronavirus. And I have seen numerous scientists say, no, this has not been peer reviewed. This person has not shown this to be true. So I've seen numerous scientists call this claim into question and say this is not a peer reviewed claim. There's not been adequate evidence provided for it. One person posted it, and it's spread around the internet. So I just be really careful about seeing somebody post something and saying, oh, it's definitely true. All right, let's see here. All right, I'm just checking for some updates. We are waiting for we're waiting for the major update, the major morning update from the rest of China. But I've heard, I know nothing about the Twitter suspension. I don't know exactly what that was for. I don't know what the Twitter policy is they broke. So I can't really comment on that. Again, still waiting for updates here. Yeah. Thank you, Gunslinger67. Thank you, Gunslinger67. I appreciate that. Thank you. So, yes, one of our viewers says there are even more. Yes. So we've gotten the Hubei province update from today. The Hubei province update was 1347 new cases and 45 new deaths in Hubei province, which includes Wuhan. But normally there would be an update from all. We're going to see an update from all of China, from the national government, of all of the cases in the country, including the non-Hubei ones. I'm thinking that'll be total around 2,000 and add, several hundred cases to the total. Actually, let me go to the national site and see if they've posted anything. I can go to the site where they post all their national updates. Let's see here. This is it. Oh. It's posted. We have an update. 2102 cases. New update. 2102 cases. 2102 total. That's the national update, just got posted. So that's going to be basically about 770 cases in addition to the Hubei cases. That's nationally, there were 2,102 cases yesterday. That includes the 1,300 whatever Hubei cases. So it looks like the total is going to go up by another 600 or so cases because some of these cases have already been included. Hang on one second, guys. We're going to get an update in a second. I want to let BNO know in case they didn't know. Maybe they've already posted something about it. So we have the national update. So basically, let me just tell, I'm sure BNO knows. So again, the new update is here. And it says 1347. And the national update is 2102, I think it was. 2102. 2102, 1347. So 655. No, 755. 755. China announces 755 new non-Hubei cases in the past day. 2102 new cases total in country yesterday. China announces 755 new non-Hubei virus cases in the past day. 2102 new cases total in country yesterday. China announces 755 new non-Hubei cases. So that's the new update. That's the new update. Again, because there were 1,347 Hubei cases and 2,102 total cases. So 268 new severe cases, 46 new deaths, and we've already had the 46 deaths. We've already heard about the 45 deaths in Hubei and 1 in Chongqing. Also, hang on, let's look at the rest of this. So, about 755 non-Hubei cases, 2,102 cases total, new. 5,000 new suspected cases. Oh my gosh. 5,000 new suspected cases. 5,000 new suspected cases. The suspected cases is up to 17,988. Oh my gosh. That's a huge number. Hang on a second. All right, so we got to write this down. I got to post this. 5,019 new suspected, and now suspected cases are up to 17,988. Wow. That's a big update in suspected cases. 5,019 new suspected cases. That's a huge jump. It's this one, right? The number of suspected cases has really gone up. That makes me think there may be a shortage in testing, because the number of suspected cases just keeps going up so much. That's an enormous increase in suspected cases. 5,000 new suspected cases. Now, over 118,000 people are close contacts. Over 118,000 people now are close contacts receiving medical observation. 118,000. There are now 118. There are now over 118,000 close contacts of confirmed virus patients in China under medical observation. Wow. All right, let's see the numbers here. Yeah, so see how it says 611 new cases? Total number of new cases is now up to 11,948. 11,948 cases. 11,948. Wow. Almost 12,000 cases. And a huge leap in the number of suspected cases. This is not good. Wow. It is certainly not dying down. And this is just the official cases. This is just the official cases. All right, let me update my graphic here. Let me just update the graphic. This is very concerning. This is very concerning. Now, look, maybe remember a bunch of Chinese, a lot of the country has been self-quarantining for the past week. You know, staying at home. So maybe that'll help things. I don't know. You know, I also don't know. You could have people quarantining at home who are giving it to their family members. So I don't know where this is going. But, you know, people are not, for the most part, people are not even working in China right now. They're not going to school. They've basically shut down a lot of the country. Let me just, again, update the graphic over my shoulder. But this is an enormous number. Even the official cases is getting enormous. Never mind the cases that haven't been, you know, the cases that weren't recorded or people never went to the hospital or anything. There it is. Hey, thanks for your support, Taryn Herring. Thank you, Taryn Herring. All right, if you have comments, if you have questions, give me a shout on Twitter, @Lookner on Twitter. But I want to show you something about, the suspected cases, because I think that's a really important number. I think that the suspected cases is very, very important. Hey, thank you, Isita, or Ilsita. I think it might be Isita. Thank you, Isita, or Ilsita. Thank you. Okay, so and let's also look at the bar graph. One of our viewers, maybe he'll send me a bar. I think Richard Eve sent me a bar graph yesterday. Maybe he'll send it to me again. But in the absence of that bar graph, I'm going to show you the Wikipedia bar graph of the case number. And I want to show you the suspected cases. It's just crazy. Yeah, so there's the bar graph in Wikipedia. Look at that. Right there. See? Oops. Why I did that. They have that graph. So the case number, if you look at how much absolute number it's gone up, 600, 800, 1800, 1400, 1800, 1900, 2100. So the absolute number keeps getting bigger. Now the percentage it goes up by is getting smaller, but it's possible that's because there's a testing backlog. What is this graph? Is that even a new? I don't know what I'm looking at here. No, that's not all. That's not up to date. But I look at the suspected cases. Yeah, so suspected cases is now up. So suspected cases is up to it's over 18,000. I think it's like what is the number of suspected cases now? Is it about 19,000? Is that what it is? 18,000. The suspected cases has gone up every day by several thousand the last few days. So see what it says here? They don't have the last line here, but the last line is 17,898. So the suspected cases keeps going up. Now, yesterday it was 15,238, and now it's 17,898 or something like that. It's like about 18,000 suspected cases. And I'm assuming suspected cases is people who have symptoms but have not been tested. And that keeps, the last few days, that's gone up by like several thousand a day. Also, I got to say, I think, so what happens is not all of the suspected cases are added to the total because every day they'll take some suspected cases off the list. They'll either confirm them or they'll show that they're not actual cases. But something about 5,000 new suspected cases means, I assume that means that like 5,000 people showed up at hospitals with symptoms. So the more the suspected cases number goes up, that's more people they need to test. I assume that's more people possibly taking up hospital beds if they're suspected cases. It's very possible it's people getting hospital treatment, at least some of them. But, wow. Sorry, there's a little noise outside the studio. I apologize. Hopefully it won't be too bad for that long. Oh, look, hold on a second. Earlier today, BuzzFeed reported Zero Hedge doxed a Chinese scientist and falsely accused them of creating the coronavirus as a bioweapon. So that might be why Zero Hedge the Twitter account was suspended. John Passantino says, earlier today, BuzzFeed News reported that Zero Hedge doxed a Chinese scientist and falsely accused them of creating the coronavirus as a bioweapon. Let's look at this. I don't know that I'd call it a pro-Trump blog. I mean, a lot of their posts have nothing to do with Trump. But it says they doxed a Chinese scientist it falsely accused of creating the coronavirus as a bioweapon. The scientist's name, photo, email, and a telephone number are being spread across American social media, according to BuzzFeed News. A popular, again, I don't know that it's, a lot of their posts have nothing to do with Trump. Has released personal information of a scientist from Wuhan, China, falsely accusing them of creating the coronavirus as a bioweapon. In a plot it said is the real-life version of the video game Resident Evil. The site Zero Hedge claimed without evidence that a scientist at the Wuhan Institute of Virology created the strain of virus that has led the world, the virus. It concludes, if anyone wants to find out what really caused the coronavirus, they should probably pay the Chinese scientist a visit. It adds their email address and a phone number. BuzzFeed News reached out to the scientist, whom it is declining to name. The rumors and lies about the Wuhan Institute of Virology dovetail with a popular meme about how the institute's logo is similar to that of the Umbrella Corporation, the shady agency responsible for making the virus that starts the zombie apocalypse in the Resident Evil video game franchise. The logo that inspired the meme isn't actually from the Wuhan Institute of Virology, but actually belongs to the Shanghai Institute. Zero Hedge has more than 50,000 followers on Facebook and more than 670,000 followers on Twitter. It is run by Daniel Avanjisky, a Bulgarian-born U.S.-based former investment banker. Zero Hedge's Wednesday coronavirus story. Is this the man behind the global coronavirus pandemic, focused on the Chinese scientist who researches coronavirus? Anyways, so that might have been, if they doxed a Chinese scientist, they falsely accused of creating the coronavirus as a bioweapon and posted the name, photo, email, and telephone number. If that's true and they posted that on Twitter, that might have been why they got banned from Twitter. Interesting. All right, so, hang on a second here. Helen Branswell, who's an infectious disease specialist, says China's January 31st numbers are up. In the last day, 2102 new cases, 46 more deaths. The total cases now confirmed in China is close to 12,000, and there's international cases as well, and the death toll is 259. She says, I expected a bigger jump, but I don't know how testing supplies capacity are at this stage. We have seen lots of reporting that there are testing kit shortages in China. And every day the last few days, the number of suspected cases that presumably would need to be tested has gone up by several thousand. There are now around 18,000 suspected cases in China. So it keeps going up. Give me a shout if you have comments, questions, if you're hearing updates, at Lookner on Twitter. Almost 12,000 cases. I'm guessing just even before tomorrow, the next morning update, I'm guessing we'll get to 12,000 cases. Because usually you'll start hearing from other countries, and then some of the provinces in China do an afternoon update. Wow, look at this. From the Lancet. This is from this morning. I didn't even see this. This new modeling study estimates 75,800 individuals in Wuhan may have been infected with the coronavirus, but authors caution the true size of the epidemic remains unclear. That's from a medical journal, The Lancet. I didn't see that this morning. But look, we've seen a number of scientists from different countries saying they think there are tens of thousands of people in Wuhan alone who have this. Let's look at the study. The Lancet. Now casting and forecasting the potential and international spread of the coronavirus. Okay, blah, 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 blah. Methods, findings. We inferred that epidemics are already growing exponentially in multiple major cities of China, with a lag time behind the Wuhan outbreak of about 1 to 2 weeks. That's important. So they're saying they believe that there are epidemics growing exponentially in multiple major cities of China, but they're about a week or two behind Wuhan. Other major Chinese cities are probably sustaining localized outbreaks. Large cities overseas with close transport links to China could also become outbreak epicenters unless substantial public health interventions at both the population and personal levels are implemented immediately. Independent self-sustaining outbreaks in major cities globally could become inevitable because of substantial exportation of pre-symptomatic cases and the absence of large-scale public health interventions. Preparedness plans and mitigation interventions should be readied for quick deployment globally. So where do they talk about results? Discussion. I want to see, where do they mention the 75,000 in here? Where's the 75,000? So they explain how they calculate all of this, you know. They go through how they're calculating all their numbers. But where is the... In the tweet it says, new modeling says estimates 75,800 individuals in the Chinese city of Wuhan may have been infected. Where is this graph in the actual article? Let's see if we can find it. I'm kind of confused. Results, fine. There it is right there. I don't know if that's gonna, that's estimated number of cases exported. Oh, here it is, look. Findings. In our baseline scenario, we estimated that 75,815 individuals have been infected in Wuhan as of January 25th. Wow. So this is important. This study estimates that 75,000 people have been infected in Wuhan, right? But that was 6 days ago. 6 days ago. So they estimated, and I'm sure they had reasons for their estimation. They estimated that as of 6 days ago, there were 75,000 people in Wuhan who had it. Wow. Which would mean more now. If you want to look at the details of this study, I retweeted it. It's at The Lancet. They posted it this morning. I retweeted it. You can go to at The Lancet. You can read the whole study yourself. Again, if you want to get all their estimations and methodology and everything, what they do is they use data on the number of cases exported from Wuhan internationally. Right. So the basic idea, this is what a lot of scientists have done. They look, this is what the basic idea is. They say, here are all these cases. Look at all the number of cases that are happening in other countries which are exported from Wuhan. Right, so that's what they do. What they calculate is they calculate this many people in other countries who came from Wuhan have it. And then they say, well, we know, you know how many people leave Wuhan every day internationally. So that's the idea, because, who knows what, you're not going to get reliable statistics from the Chinese government on this I would think. And there's all kinds of reporting that cases have been covered up and deaths have been covered up and not reported. But what you do know is you do know how many people in other countries have been confirmed to have the virus, and people, and how many of those people in other countries came from Wuhan. So we're constantly reading about people in other countries. A lot of these cases are somebody traveled to Wuhan, or they're from Wuhan and they were visiting the other country. And what they do is they take the number of people who've been confirmed to have it in other countries who came from Wuhan, and then they also figure out, well, this is the amount of people every day who, say, fly out of Wuhan and take a train out of Wuhan. They know roughly the number of people leaving Wuhan every day, and they say, well, if you can calculate what percentage of people leaving Wuhan every day end up being diagnosed with this case. And so that's the kind of numbers they use. And I've seen other studies do that as well. They rely on the number of people who've been diagnosed with it internationally who came from Wuhan, and the numbers about how many people leave Wuhan a day. And the number of people leaving Wuhan a day is way less than the number of people who live in Wuhan. So and look, I would not be surprised by this because, as I've said before, when you look at the number of cases even around China, when you look at the number of cases around China, not in Wuhan, and around the world, so many of those cases have Wuhan connections. We've done this over and over again where another province will announce their cases, and like 90% of the cases are people who came from Wuhan. So I've been saying all along, I've been saying there's just no way that all of these people have gotten this virus from visiting in Wuhan or passing through Wuhan or working in Wuhan. There's no way all those people who are not residents of Wuhan, who got it from just traveling there or working there or whatever, there's no way they all got it. And lots of people who live there full time haven't gotten it. Because so many people have gotten it who don't live there full time. But what about the people who actually are there full time? So I would not be surprised if something like this is true. That there's, they say they're estimating 75,000 people had it as of 6 days ago in Wuhan. Hang on a second here. So it's I would believe it. I would believe it. And they're not the only one with numbers like this. There's been a number of there were scientists in Hong Kong like last week who said they thought that like 40,000 something people had gotten it. Hey, thanks for your support. High North Productions. Generally speaking, all the when the scientists have estimated the number of cases in Wuhan, that's the method they use. Look at the international cases, figuring out how many there are from Wuhan. You roughly know the numbers of how many people leave Wuhan every day, and then you use that to calculate the total number of people in Wuhan who are estimated to have it. All right, so we are covering this live. We're bringing you live coverage of this China coronavirus. The numbers just keep going up. Over 2,100 cases reported in the last day in China, including over 1,300 in Hubei province. And you can see the numbers, close to 12,000 cases around the world, most of those in China, 259 dead now. And something else to keep an eye on is, so we've gotten the update from China, the morning update, but we've not gotten the update from a lot of individual provinces. So what's going to happen now is a bunch of provinces are going to report their individual numbers for the day. For yesterday, and those won't be added to the overall total, but they will be added to the province totals. So these numbers for the provinces are going to go up. And as I mentioned, something else which is highly concerning is cities that are not Wuhan getting huge number of cases. In particular, there are cities near Wuhan. So as I posted before, I have these numbers right here. Huanggang, which is a city of 7 million people, That's next to Wuhan. Oh, I got to show you something about Huanggang, by the way. They have over 700 cases now in Huanggang. Zhaogan, which is next to Wuhan, has over 600 cases. These aren't even in Wuhan. So who knows how many cases are going to keep arising in other cities. It's not just one city. It's in so many cities now, all across the country. So you can't just isolate people in one city. Hey, thank you, Billy Stahl. Thank you, Billy Stahl. Oh, and real quick, I like to mention this once in a while. So if you're new to the channel and you see somebody makes a donation once in a while, you might think, why are you accepting donations when you're talking about this horrific thing where people are dying and getting a virus? Perfectly good questions. But here's the deal. I do this channel full-time myself. I don't have another job. If I didn't accept donations, I couldn't do the channel. Unfortunately, I'm not a billionaire, so I can't spend every day, day and night, 7 days a week doing a news channel because I couldn't pay for anything. Like I don't have any source of income. So the donations are what allows me to do the channel. So I really appreciate the donations, but I just want people to know I'm not doing a broadcast about a virus so I can go take a vacation to Hawaii. The donations are literally what lets me do the coverage. So I wish I didn't have to request donations. I don't even request donations on these broadcasts. I don't ask for them during the broadcast. Once at the end, right at the end of the broadcast, I mention it, but I never ask for it during the broadcast. All of these broadcasts, I'm not asking for donations during it. But some people want to give them anyway, but just so people know, that's where it goes. Unfortunately, the choice is accept donations or don't do the news channel and go do something else with my life. So that's the choice. That's why I accept donations. All right, let's see here. Oh, I want to show you the thing about Huanggang. Hey, thanks, by the way, to Hastings BNSF, N-Scale Modeler. I appreciate that. And thank you, Kevin Campbell. I appreciate it as well. Thank you. Okay, so, and thank you, Captain Trips. All right, I want to show you something about Huanggang. And thank you, Lone Star Carper. Lone Star Carper, thank you, Lone Star Carper, and thank you, TD, for your support. I appreciate that. Thank you. Thanks, TD. Here's Huanggang. Thank you also, Mama of Six, and thanks for mentioning the mods. I really appreciate the moderators in all of our channels. Thank you, moderators. Mama of Six says, do you think the numbers are higher? Oh, well, yeah, I think they're higher because there's lots of scientists who believe the numbers are way higher, and B, there's lots and lots of reporting about cases not being marked down as virus cases or people not getting tested. So I certainly think the actual numbers are higher. Thank you, Shipfox, by the way. I appreciate it, Shipfox. Thank you. All right, so that's Huanggang here. Huanggang is a city about 7 million people, and it's next to Wuhan. Huanggang now has over 700 virus cases, So what I wanted to show you is this here. This is from Kai Zin, I think it is. Oh, hang on a second. Let me just actually get this here on the screen for you. Thank you, by the way, Mr. Jingles Turd. Thank you, Mr. Jingles Turd. I appreciate that. And thank you to Snoop Zach T1. Thank you, Snoop Zach T1. Thank you, Tanya Since Felicity. I appreciate that, Tanya. Thank you, VUF Berlik, I think from Denmark. Thank you, VUF Berlik. I appreciate that. Thank you, 9 Fathoms. And thank you also to Eric Bauman. Thank you, Eric Bauman. I appreciate it. And thank you, Eric, for thanking the mods. Thank you. Here's this article. Hang on one second. Now I have to load the article. Here it is. Here is the article. Kaizen. So, as I mentioned, Huanggang is a city of like 7 million people, and it's next to Wuhan. And Huanggang now has over 700 cases. So this is an article. I'm not going to read the whole thing, but I'll show you some of it. It talks about the situation in Huanggang. It's from the Chinese outlet Kaizen. Oh, and thank you, tree climbing. I appreciated tree climbing. Thank you. It says Wuhan is not the only place in Hubei province pitched in a life and death battle against the virus. Nearby cities like Huanggang took in millions of people from Wuhan before Wuhan was locked down. And now cities like Huanggang are overloaded with afflicted patients. Such places are in the midst of severe shortages of medical supplies and qualified professionals, with potentially infected patients swamping local clinics that cannot confirm whether they carry the virus due to lack of resources. See, they can't confirm whether they carry the virus. They don't have the resources to test them. And again, this is from Kaizen, and this is about Huanggang. Huanggang is much less known than Wuhan. Nonetheless, it's the second most affected city. And they said, this article says they got a lot of people who fled Wuhan and ended up in Huanggang. Other than Wuhan, Huanggang has the highest number of confirmed cases, death cases, and daily growth rate. Huanggang is now over 700 cases. Huanggang's situation may be much worse than its numbers suggest, as the city may have more than 1,000 cases when taking into account suspected but unconfirmed infections as of Wednesday. Many patients are simply waiting for the tests needed to confirm whether their symptoms come from the new virus. There's a testing backlog, but resources are either prioritized for Wuhan or still in transit. Traffic lockdowns and logistics blockages are among the factors that lead to near total exhaustion of medical supplies in cities like Huanggang. The governor of the province, I believe, said, medical workers said the supplies in local hospitals in Huanggang would run out in just 2 or 3 days if they're not replenished in time. By the day after tomorrow, even protection owed to doctors and nurses at the front line may not be guaranteed. This medical worker was most concerned about the extremely high risk of within the hospital contagion, as doctors outside the isolation wards were working under only basic protection measures. Who knows how many medical workers have been gotten sick from this? It's just terrible. This doctor said our masks will be used up by tomorrow, so there will be none for the day after. So many people on the outside said they would donate, and medical companies said they were sending supplies, but nothing has arrived. According to hospitals in Huanggang on Monday, the city lacks over 1.7 million masks, over 3.2 million surgical masks, over 95,000 goggles, and at least 270,000 sets of protective clothing. So again, this is it's Huanggang. That's not even Wuhan. And that's another city which is experiencing shortages of medical supplies, dangerous contingencies for medical workers, huge backlog of cases they're unable to test. So just not a good situation. Hey, thanks. All right, let's check the numbers here. That's from Kaizen. We're still at 11,948. Thank you to Laughing Mom Thank you, Laughing Mom. Shermanator says, has numbers recovered past numbers passed away yet? I'll check the numbers recovered in a second. Thank you, Timothy Culebra. Timothy says, is China doing what people did in Africa to get Ebola under control? So for any virus, the way you have to control it, if it's spreading and not dying out on its own, is you have to figure out who has it and isolate them, and who might have it and be giving it to others, and keep an eye on them or isolate them if they could be contagious. So that's what you need to do. Now, a problem, I don't know about Ebola, but a problem with this virus, a possible significant problem, is that there's evidence that people without symptoms can spread the virus, which makes it hard to figure out who do you isolate. I mean, if you don't know which people without symptoms have this. So there could be all these people, running around without symptoms giving it to someone else, and no one knows they have the virus. So that's a problem, and that might be a difference with Ebola. So the rate of spread might be different, but also, it's easier to control a virus if people can only spread it if they have symptoms, because it's easier to figure out who has it. Also remember, there's plenty of reports that cases were happening since the beginning of the December, if not earlier in China. There's reports of the Chinese government not acknowledging this and not really paying attention to it for weeks. So if that happened, there might be all of these cases around the country and all of these possible cases that the government's not even aware of. So the only way you can control it is figuring out who has it and who might have it and keeping them from other people. So when you're trying to figure out, is it harder or easier to control this than another virus, you got to figure out, well, how easy is it with this virus compared to another virus to figure out who has it and who might have it and keep them away from other people? Those are going to be the differences, because that's the only way to stop it. No vaccine for any human coronavirus, no treatment. Once somebody is suffering, there's no medicine you can give them to make them better. Thank you also, Ken Oliver. Thanks, Ken Oliver, for your support. And Xylia. Thank you, Xylia, for your support. And Woke in SoCal. Thank you, Woke in SoCal, for your support as well. And thank you also to Lee Salmonen. Thank you, Lee. And Love Thunderstorms. You can write to me on Twitter, is where to write to me, @Lookner on Twitter. Thank you, Love Thunderstorms. And I was going to check, somebody asked about the number of recovered total. This is the daily update from China. As you can see, there were 2,102 new cases yesterday, 5,019 new suspected cases added yesterday, 72 cured cases yesterday. So no, the total number of deaths is 259. The total number of people cured doesn't mean given a cure, because there's no cure. Cure means released from the hospital because they felt better. So only 259 dead, 243 released from the hospital. Almost 18,000 suspected cases. I assume that's people with symptoms who need to be tested. And over 118,000 people who are close contacts of those people, over 118,000 people who are close contacts of somebody who got the virus, who is being medically observed and may be isolated, because they could get the virus too if you're a close contact of somebody who has it. Over 118,000 people now in China under medical observation because they're close contacts. Thank you, Michelle D, for your support. Thank you, Michelle D. All right, I'm going to check some of your messages, and we are continuing to update you on the latest information. Thank you also to Jay Gom. Jay says, could this affect the world in waves? One version across the world, sweeping across the world, followed by a mutated version sweeping back across the world shortly after, and so on. Scary thought. Well, a couple things in regard to that. In terms of mutations, I've read a bunch of articles suggesting the virus could mutate and become a worse version, although I've also read some articles suggesting it has not mutated. I read one article last night that where an expert said they did not think it was going to mutate and become worse. But so I don't know what to say about the mutations. I've seen different things. Here's something about in the Nature article about mutations. But something else I've seen is the possibility that this could become like the flu, where it just becomes established around the world, and every year every X number of months there's more cases of it. That's certainly a possibility I've seen raised. This is from Nature. What's next? I'm not going to read the whole thing, but if you look here, it says, is the virus here to stay? One big question is whether the virus is here to stay. If efforts to contain it fail, there's a high chance it will become endemic. That's when it continually pops up in a certain area. As with the flu, it could mean that deaths occur every year as the virus circulates until a vaccine is developed. So that could happen. Is the virus likely to change? Some researchers are worried that it could mutate into something even worse. This researcher at Scripps Research in La Jolla is not concerned about the virus becoming more harmful. He says viruses constantly mutate as part of their life cycle, but those mutations don't typically make the virus more harmful or cause more serious disease. So I've seen some articles where they say people are worried about it mutating. This expert seems to be not so worried. Who knows? It certainly could mutate. It also says, hold on a second. Anyways, most mutations are detrimental to the virus or have no effect. But again, it could in theory mutate and become worse. So anyways, if you want to see this article, go to Nature, the site Nature. Thank you, by the way, I Fish for Pleasure, for your support. I Fish for Pleasure says, I think it's very contagious, but a lot less lethal. Well, it depends on what you compare it to. It appears right now it's less lethal than SARS because SARS killed about 10% of people who got it. It appears less lethal than MERS because MERS killed about a third of people who got it. But it might spread much easier than SARS and MERS did. It certainly looks like it does. There were only about 8,000 cases of SARS, only about 2,400 cases of MERS. There's already about 12,000 confirmed cases of this, and who knows, it doesn't show any sign of letting up right now. Thank you also, Wendy a Christian. I appreciate that, Wendy a Christian. Thank you. Thank you also, Jesse Marzin. Thank you, Jesse Marzin. And thank you, Lisa K. Thanks so much. All right, so we're continuing to watch and see. I want to see. It's 11,948. I want to see. Are the provinces reporting yet? We should be getting individual province reports where we start seeing where these national cases are. So I want to see that. Also, I'm going to take some comments in a second. Write to me on Twitter @Lookner. I do want to say a quick thank you to the moderators who are doing amazing work. The moderators are all volunteers. So they really are a huge help, the moderators. So please join me in thanking the moderators, if you'd like. Rusty G is moderating, Michael B in our YouTube chat room, Danny James, Trish Lansher, Mark Helton, all in our YouTube chat room. Garth Russell is there moderating. Thank you. Also, thank you to our Periscope moderators. Linda Belk is there moderating. Thank you, Linda. I know Sharon Craig has been in there. Texas Legends Brian has been in there. Texas Legends fan Brian. So thank you to our Periscope moderators. Also, Katsy has been in there. Thank you also for the Super Hearts. Thank you, William Bowser, Gunter Doze, Timothy Cornegay, Hodo, Mark Twain, Maria Ayoyero, JT Maddie, Deb H, SQ Tweets, Texas Legends fan Brian, America Heather, Chris the Mystic Autistic, and Irma Faircloth for the Super Hearts. And thanks also to Farva. Thank you, Farva. And thank you to our Facebook moderators. We have, I know Courtney Lane has been moderating in the Facebook chat. Thank you, Courtney. And thank you also to, I owe Eric McClure. Thank you, Eric McClure, for the Facebook stars. Eric says praying is our value is not as high as what they think. Thank you also for the Facebook stars. Renee Rossi. Thank you, Renee. Thank you, Jenna M. Kennedy. And thank you again, Eric McClure. Eric mentions the R naught value. As I've said before, R naught is the number of people on average a new person infected. It's the number of people they will infect. It's just not known right now. Also, scientists are relying on very limited data from China. It might be there might be all other huge numbers of people who have this who are not parts of the official data. So it's just unclear right now what that number is. I've seen some different estimates, but it's based on imperfect data. Thank you also, Samantha Bennett, for the Facebook stars. Thank you. Renee Rossi, Jenna M. Kennedy, and Corby Kessler, and the others. And also thank you to our Twitch moderators, people like Daily Disclosure, Matthew Johnson, Umarath, Idaho Star Smoke, Callie, Keisha, and others. Thank you, Captain Trips, for your support. And of course it is contagious because other people are getting it, Captain Trips. Thank you, Captain Trips, for your support. All right, let's look here. Sorry, I need to close some things. There's so much going on, and I have too many things open, and I need to close some things. Too much open here. Okay, that is a little better. Let's see here. Please stop sending me the post. Please stop sending me the post about the purported connection between HIV and the coronavirus. One person posted it today. Now all these people are sending it to me. As I mentioned, I've seen a number of scientists say that has not been shown, say that that has not been peer reviewed, that claim. So please stop sending me that tweet about the supposed HIV connection. Just because one person posted on Twitter does not make it true. So please don't send it to me anymore. I keep getting it. I'm not going to show it on the air. So please stop sending it to me. If you see, say, the New England Journal of Medicine post a paper about it, if you see a report in multiple major news outlets about it, that's different. If you see the WHO say something about it, send me that. I'm happy to report on it. But one person I've never heard of on Twitter saying something does not make it true, and to me does not even make it credible. So please stop sending it to me. Oh, we have our chart from Richard Eves. Thank you, Richard Eves. I love it. This is our viewer who made a chart. He makes really good charts. So here is a chart with the new cases. Oh, this is suspected cases. Oh, this is suspected cases. He probably sent me something with, this is not actual cases. This is the growth in suspected cases every day. So the blue line is suspected cases. That's how suspected cases have gone up. In the last several days, suspected cases have been going up by 32%, 32%, 25%, and 25%. And every day they get rid of the green line. The green bars are the number of suspected cases they've gotten rid of from the previous day, I think maybe. But you can see the jump in suspected cases. A week ago, it was only about 2,600 suspected cases. It's such a huge difference. Yes, 1 week ago, it was about 2,000 suspected cases. I'm assuming these are people with symptoms who need to be tested. Now it's 18,000. Thank you, Richard. I wonder if Richard sent me the chart of the actual cases. Oh, Richard also sent me these other charts. Here's the actual cases. These are Richard's graphs. So this is all of China. This is all of China, okay? You're looking at all of China cases. The blue bar is the number of actual cases in all of China. The percentage here is how much the number of cases in China has gone up since the previous day. Now, you might look at this and say, well, Steve, what's happening is the number of cases is going up, but it's going up by less and less each day. And you'd be right that the number of official cases is going up by less and less each day. The problem is there's a huge backlog, apparently, of cases that need to be tested, and the number of suspected cases is going up a lot. So it's possible that if they actually had been testing all the cases and didn't have a test case shortage the last few days, these numbers would be much higher. Richer. All right, let's see here. Here is... All right, hang on one second here. If you have comments, questions, write to me on Twitter at Lookner. Oh, look, so about this supposed link between the coronavirus and HIV. So it's Derek Lowe says, this paper has just been published. I would be extremely interested in seeing comment. And the paper that he links to is this paper, Uncanny Similarity of Unique Inserts in the Coronavirus Spike Protein to HIV. Well, here's an assistant professor from Stanford who says, just check their results. The similarity is spurious, which means false. Out of 4 inserts they identified between the coronavirus and SARS, 2 are found in bat coronavirus. Of the remaining 2, only 1 is most similar to HIV and is so short. So again, she's saying their claim is false. That's an assistant professor at Stanford saying. I checked it out, and she explains why she believes it's false, what this paper said. That's Silvana Konerman. And I've seen many scientists saying they've looked into it and they believe it's false. Or they believe it's certainly unproven. Still at 11,948. 11,948. And we still haven't gotten updates. Maybe they're not updating for the moment. I'm waiting for the updates. I want to see what the individual province numbers were for yesterday to see how these province numbers go up. But we haven't gotten that yet. Oh, look, hang on a second. Carol Campbell sent me this. On Zero Hedge, this account Zero Hedge was suspended on Twitter, a popular account. Suspensions comes after, Oliver Darcy says, suspension comes after, according to BuzzFeed News, the site released the personal information of a scientist from Wuhan, China, falsely accusing them of creating the coronavirus as a bioweapon in a plot it said is the real-life version of the video game Resident Evil. Twitter spokesman tells me the account was permanently suspended for violating platform manipulation policy. Report that the Zero Hedge suspension on Twitter is permanent. Is it one or two words, Zero Hedge? I thought it was one word. Oh, it's not capitalized. So Twitter has told Oliver Darcy that this account was permanently suspended. Platform manipulation policy. What is platform manipulation policy? Let's see if we can find that. Twitter platform manipulation policy. You may not use Twitter's services in a manner intended to artificially amplify or suppress information or engage in behavior that manipulates or disrupts people's experience on Twitter. Platform manipulation can take many forms. We define platform manipulation as using Twitter to engage in bulk, aggressive, or deceptive activity that misleads others and or disrupts their experience. Anyway, so you can read more about this. Hang on a second here. On Twitter, if you want to read more about it. But Oliver Darcy says... Twitter's Fox tells me the account was permanently suspended for violating our platform manipulation policy. Thank you, Carol Campbell, for passing that along. I appreciate it, Carol Campbell. Thank you. Taylor Jensen says, to be fair, the original story wasn't a tweet. It was in a medical journal. It has not been peer-reviewed and is likely untrue, but it's from real scientists doing actual science being published in real journals. Well, first of all, let me say this. Most of the people who've been writing to me about it, if not all of the people, and I've seen posting about it, are not posting a link to a medical journal. They're just posting a tweet. So I wasn't even aware of the paper until we were on the air. I was just seeing the tweet being posted. So, again, a lot of people were writing to me saying, hey, look at this tweet. So, you know, a tweet does not make, one tweet does not make something true or even credible. Now, in terms of being from a journal, I would want to know what journal is it. You know, there's plenty of journals are seen as more or less credible. There's some journals which people might look at professionals and say, oh, well, if something's published in that journal, it doesn't really mean much to me because they don't really, if a journal, something being published in a journal only makes it credible if that journal has some kind of rigorous standards. So you say, to be fair, it wasn't a tweet, it was in a medical journal, it has not been peer reviewed. Well, if it's in a medical journal where they don't actually peer review what's in the journal, well, then why should I give any credibility to what's in the journal? The fact that it's in a journal doesn't make it more credible if the journal doesn't have any standards. So